touched in that way, the brain immediately stops growing on the emotional side. And until these young men have the opportunity, like I did, to actually connect the damage and to understand, more than likely, I'm not sure, but more than likely, they probably have already developed tics and certain addictions that they are using to survive life itself. Because if you look at them, I think the youngest now will be 18 shortly, and the oldest is 27 or 28. You're going to see a full-grown man. But in reality, you're going to see a man that is so wounded emotionally that unless he gets the support and the help to connect those wires that were basically severed, and those stems, as I've learned on my own journey, are completely severed from the sexual violation. I read the grand jury report, and unfortunately for those young men and myself, I've experienced exactly the same things that they're reporting there in that report. But there is hope, but there is only hope with the fact that they get the kind of trauma therapy that they need. There's even, I think, a specific type of therapy that's needed more so than just a therapist that's going to diagnose their depression.
And Peter, I want to again emphasize what you're saying is that we live in a time now with a lot of the mental health needs of many young people and adults that are the result of trauma. So there are armies of professionals geared up to deal with trauma and to do the trauma therapy, but it takes time and it takes resources, as you say. I certainly hope these kids are going to have access to that because